Okay, I've got another little bit to say, and then Anthony, I think, is going to get up and say a few things. The first thing I want to do is, on behalf of the Institute for Creative Health, certainly say a huge congratulations and thank you to Country Arts SA for putting on this forum. I think they've done a great job, and as always with Country Arts, it's not just sort of one or two people, it's usually a team effort. And Jo Pike, who's sitting up there hiding, was the producer behind it all, but I know she had a great team behind her as well. So thanks for all of that. The next thing I wanted to do was introduce you to the Institute for Creative Health has leadership groups that they've set up or in the process of setting up, where they're all underway bar Northern Territory, which is in development, in every state. And we have one here in South Australia. And I just want all those members that are still here, some have had to go and some couldn't get here today, but could the leadership group members stand up that are in the room? There's some up there. Sonia's up there. Lenore. David Chappell's also, some of you would have did the... there he is, up the back there. And Sally Francis was unable to stay, so you all would have seen her on stage, and there's a couple of other members as well. So I guess if you want to have a chat about that, the leadership group and what's involved, and hopefully after today you definitely will, after the rest of what I've said you definitely will, check out these people and the drinks afterwards and have a chat to them or come and see me. So the last sort of 15 minutes for the day, I will say for me is I've suggested a bit of part reflection, part rant, which is what my kids think I do every day and night, and a bit of a part of a sales pitch as well, I guess, which you've already had a bit of today in terms of arts and health, and you're already sort of on board, you're all ready to sort of sign up. But the first thing I'm just going to get you to do is, I keep looking there and there's one there, and we were keen to have a think about where to from here. So often we come to these sorts of events and we just sort of go, oh, that was lovely, learned a few things, met a few people, had a glass of wine at the end, it was great. So we're keen for you to think a little bit more deeply about it than that and think about what action you'd like to take. So there we go. So I just want you to have a little reflection just for a couple of minutes. You can have a chat to the person beside you if you want to, if you just want to sit there quietly and think about this yourself, and just think about some of those things in terms of what or who inspired you, what made it inspiring, are you going to do anything different now, and what that might be. So just a couple of minutes talking to the people beside you, or as I said, if you just want to think about it quietly to yourself, that's fine as well. Go for it. Chat away. Still awake. Okay, everyone, I'll just pull you back in for a minute. I'm always loath, that's great chatter going on, and I'm always a bit loath to sort of stop that, but I think at the end you'll get a bit more chance to sort of talk to each other and share, and hopefully you'll go back and have those conversations with your family, with your colleagues, in your workplaces, if you work on your own, certainly with friends and other people that you might collaborate with. Two things I sort of wanted to talk about today, and leadership is certainly something that at the Institute we're very interested in. So that's probably my prime focus for being here, and this is sort of me throwing down the gauntlet to you in terms of being leaders. And I'm just going to skip to this slide. And the reason why I'm keen to see more leaders in arts and health is because I think that the arts and health sector has a massive opportunity. And there's a couple of people that sort of touched on that today. For those of you that saw Christina Davies' session just before, she talked a little bit about art and sport and where sport is now in terms of the health realm. And certainly John this morning as well, I think, touched on a little bit. So as I've said there, I think arts and health has massive potential to reduce the overall healthcare burden. We absolutely have the capacity to save people, individuals, money, and us as taxpayers and governments and hospitals and those sorts of things. Absolutely. I think there is evidence already out there. We need more. We just need to keep talking about that. And in talking about it in those economic terms as much as everything else, which is hard, I get that, but it needs to happen. I'm going to talk about I'm really loath, I'm not about to say sport or art, I'm loath to do that. I love sport, I go to the football, my kids play sport, I've played sport, I think it's great. But I think it's an interesting comparison. I read a report this week actually I didn't read it all because it was a finance report, so, let's be realistic. But I read some key statistics out of it, and it said that Australians spend $8.2 billion a year on gym memberships and sports equipment. And we can absolutely drag out statistics and say more people go to galleries than go to football, and I get that. But this is about the individual spend. This is about people participating in sport, not making, when you go to a gallery, you're not making the art. This is about participation. So they're going to the gym, they're working out, they're buying sports equipment because they play tennis, they play squash, they play netball, they're buying runners because they go jogging, whatever. And that's a massive amount of money. And I think that we have the opportunity to shift art into that realm, to make it part of everyday life, that it is absolutely something that we all just do. No one questions anymore whether sport is healthy. We just do it. Some of us do it, some of us don't do it. But even the ones that don't do it know that we should do it and that it is healthy. Imagine if we got to that point for art. So imagine instead of gym memberships, we had art studio memberships where you could just pop in any time. They're 24-hour art studios, and you can pop in. You don't even have to wear lycra. You can wear smocks. And you can just dabble if you want to. There's lots of equipment there, like you would go and get on the treadmill. Instead of that, you're on the printing press. And you're just doing it because you know it's good for you, and that, according to Christina's report this afternoon, you need to do that at least 2 hours a week, which is not, they say you've got to go to the gym every day. So you wouldn't necessarily even need to go every day, but you could. And again, the vision, imagine if instead of group classes, so you're not doing an aerobics class, but you're building a collaborative artwork together and you're part of some sort of community output. But then again, it's a collaborative exercise. I just think that it might seem like an insane and ridiculous vision, but 50 years ago, people weren't going to gyms and they didn't automatically think that they had to play sport. Blokes played footy and cricket. Some girls played netball and tennis. It wasn't a huge part of our lives, but it is now, and we absolutely accept it. So again, hopefully it won't take 50 years, but I'd like to think that that's where we'll be. I'm going to go back a slide because I think I put these sort of around the wrong way. There's over 1,300 hospitals in Australia, and that's a statistic that I got, from a couple of years ago. But imagine if we had an art studio in every single hospital. Imagine the jobs. Imagine how many artists would be employed in this country if we had art studios in every single one. And so when you're recovering from your hip operation or your wrist operation or whatever it is, you're prescribed dance classes and painting classes and all sorts of other things. You went to learn, and it was you went there and filled your prescription. 24 million people in Australia, 1 in 5 Australians are affected by multiple chronic diseases. That's a lot of people that are not feeling 100% and that would like support and help to feel better. And the arts can do that, as we know. 45% of Australians aged between 16 and 85 have experienced some sort of mental disorder. Huge talk today about what it can do for mental health. Again, it's a given. We feel like it's a broken record. So we've done that one. So this is some of the data that I think supports our argument. And I just want to go this, and so there's been a bit of people talk about it today, and I'm not sure how easy that is to read, but theatre goers are almost 25% more likely to report good health. People who participate in creative or cultural activities are 38% more likely to report good health compared to those who don't. That figure rises when you're talking about dance to 62%. When music or visual arts are used in hospital environments, there is evidence of improved vital signs, reduced stress, anxiety and blood pressure. Arts in clinical settings has reduced the length of hospital stays and fewer GP consultations, and that can absolutely be translated in dollars. Trends in arts and mental health programs suggest a 50% reduction in the abuse of depressants such as alcohol, heroin, prescription drugs, etc. by participants. So they're leaning on those other things less because they have other opportunities to feel better about themselves. So the data's there, and I've got these from a few different reports, but it is out there, and I will admit as much as anyone that sometimes it's really hard to plough through because researchers are fantastic at producing, 150-page documents, and you really want the sort of the two key facts that you can pitch in an elevator to the minister if you're lucky enough to be in there with him. And that's hard, and the Institute's certainly trying to sort of filter out some more of that information, but it is challenging and it's time-consuming. So your help on that would be greatly appreciated. So why are we here now? For a few reasons, because Country Arts had the vision to put it on. But I think because you all care a little bit about, this practice and this field, and you're interested. In terms of the Institute, as I said, we're very much interested about leadership. So we have leadership groups in each state, which I've already said, and Country Arts invited us, the leadership group, to be part of this session, to be part of this forum, and the leadership group here was part of the sort of the advisory group that helped sort of shape the program. We are very much interested in developing leaders in the sector. And what I mean by that, I don't mean the big, run the country leadership. I think people often get sort of tunnel vision about leadership, that it needs to be this person that's standing up at the front of the room. That's not the case at all. For me, it's about people who are, though, willing to step outside of their day-to-day jobs and their day-to-day practice and their roles and think about the greater good. What is it that they can contribute back to the sector? So sometimes that is about getting up at conferences and spruiking it. Sometimes it is about ringing the local newspaper and letting them know that things are happening. Sometimes it is about advocating in your workplace for a change in environment to do with, whatever it is that you happen to be managing. So if you're out there and you want to do that, we really like to hear from you. If you work for an organisation and you have staff that report to you and you can free them up for some time to contribute to, the greater good of arts and health in South Australia and nationally, let them do that. I think it's really, really important. And if we don't do that, I think that in 10 years' time, we're still going to be sitting here having the same conversation. Our areas of interest in terms of the leadership group at the moment are, advocacy, which comes up time and time again. Skills development, networking and research and evaluation. So they're the areas that have been identified by the leadership group in terms of what we're interested in, but we are interested to hear from you in terms of what you would like. And I'm going to give out some forms in a minute to ask you that. But on the advocacy thing, I will say, Christina, again, in her session just prior to this one, Christina Davies from WA, she talked a bit about advocacy in hers. And I find it fascinating. So hands up, who amongst this group do you think, are you expected to advocate in some way, either for your clients or consumers or patients or your colleagues or just the work that you do? Hands up who thinks that they need to advocate on some level. How many of you have ever done any advocacy training? Yeah. So we need to work on that a bit, I think. And for some people it comes quite naturally. Some people, and people do it in different ways. Some people, sort of rock up with the placards. Some people sort of have the quiet conversations at the side of the room. And both of them are perfectly reasonable. But it would be good to have a strategic approach to how we do that. And it would be good for us all to be working together. So that's what we're keen to do. So in terms of the last bit for you today, I'm going to hand out these forms and we'd like to capture your details. So this is the start of a broader network in arts and health, we think, and not to say that there isn't already informal ones that exist amongst different people, but we'd certainly like to sort of strengthen that. So I'm going to hand out these forms and get some of the leadership guys to hand them out. And if you can fill those in, most people will have bought pens. So it really is about asking you which of those interest areas you're keen to be involved with, or if there's another one. It is about you saying what it is that you'd like to do today. It is about you also nominating other people that might not be in the room that you think should be part of the conversation. So we're all for tapping people on the shoulder, unashamedly. So do that by all means. And obviously capturing your contact details. It can be anyone. Anybody that you think should be part of a conversation in terms of leadership in arts and health in South Australia that you think has something to contribute. It would be great for you to let us know who that might be. And we might contact them and already know them, or they might already be involved in some way, or they might not be interested and they're too busy. And I get too busy all the time. Everyone gets busy. It's not an excuse. If you want something done, give it to a busy person.
Is the address, email address or
Email address is a preference. We will be contacting you electronically. You will get an email from us. Has anyone not got a form? So when you've filled it out, perhaps just wave it in the air and we'll come around and collect them. Thanks. All right, Mark's coming. Just about. Yep. That's wired. Oh, that's a really hard and challenging thing, but it's about, that's a long conversation, but I guess it's about, this is a test really, isn't it? It's about, well, it's a combination of promoting what it is, what you do to people of influence so that you can challenge people and change the way people do things. In a nutshell. People could probably come up with 3 other definitions. Yeah. Champion's a good word for it as well. So I'm going to finish up. I guess the last thing I'm going to say, or 2 things I'm going to say. One is a great position of advocacy to be in is coming up to a federal election, so that you all have an opportunity at this stage to advocate for the work you do. Get informed in terms of arts policies. The Greens party threw down the gauntlet last week and released their arts policy, and we're waiting to hear. Labor's certainly made a few promises over the last 12 months with changes in arts funding, and we're sort of still waiting to hear from the Liberal Party. Jane? We should go and grab him. Jane, but go and have a chat to your local member. Just ask them. It can just be a simple conversation. What do you know about arts and health, and would you like to know a little bit more? Because I can tell you. And that could be just about the work that you do in your place, or it could be about the broader sector. If you want some advice about that, let us know. And look, in terms of arts in general, there's lots of stuff. The Arts Industry Council of South Australia has some great advice on their website in terms of contacting your local member and what to ask them and those sorts of things if you're a bit stuck. But it is a great opportunity. Elections don't come around very often, so now's your chance. Stay in touch. That's our website address, and also Country Arts as well is on there. So stay in touch. Both organisations have got a lot to offer in terms of information and support. Country Arts, particularly through their funding program, are very well known for funding great arts and health initiatives in regional parts of the state. So if you're interested in trying something new, talk to them about funding it, and they'll be happy to have the conversation. Now I'm going to hand over to Anthony. Thanks, everyone.
Thanks, Maz. We're almost there. Firstly, well done to you all. You still look mildly awake, and you're probably getting slightly more awake because there's a glass of wine just around the corner. And I'm not going to keep you for very long because I'm also looking for that glass of wine around the corner. And there's someone down the end there who has their form. Christine's going to get it. Great. So firstly, I'm just going to say thanks. Thanks to all of you for making the time. It's a full day. It's been a full day. It's been a great day, though. Today's the first day of winter, and actually today's felt really warm, both in here and out here. So well done to you all for contributing to that. Thank you to the Institute for Creative Health for helping us develop the day. And look, I have to say the lineup of speakers has been truly amazing, and the conversations have been great. So thank you for that. Thanks to the Science Exchange. Thank you to the Australia Council for the Arts. We were able to put on this day because of the funding we received from the Australia Council. This is part of what we do to help to develop the sector. And also to Arts South Australia, whose funding has also helped us make today possible. If you can put up with me for just 2 more minutes, I'm going to share with you the takeaways I've got today. Not because I'm about to give you a lecture or anything, we just thought it was a nice way to finish. So we started the day with Uncle Mickey, who basically told us the story gives us the answer. And actually, in many ways, I could just stop there, but I won't. Just bear with me, I've numbered these in a certain order because I felt like there was oh yes. Then we had Professor John Coveney. Wasn't he fantastic? And I loved it even more because he spoke about pleasure. And I thought, well, if we're going to start the day with pleasure, it's only going to be a good day. So that was great. Moving right along. Oh, the numbering. Okay, so we spoke about arts and health giving people a sense of ownership, about it validating their individual experience, and we all know how important that is. Dr. Christine Putland, where are you, Christine? You spoke about fields of practice, and we also spoke about practice-based evidence actually being the policy. And I think for me they were kind of good takeaways in terms of the work that we're doing, not just being good, but actually it is actually a practice. It is actually valid. It is valid in itself. I love the talk by Dr. Christine Davies. She had this wonderful scale of happiness, which had a sad face at one end and a very happy face at the other end. And she said when it came to the arts, normally it's a 5-point scale. When it came to the arts, 5 points weren't enough. You needed many more gradations along the way. I thought that was really interesting. Someone else said that the doing is what's most important. So it's great to have this talk fest, but actually we need to get out there and just do it. We took part in dance and movement today. We felted, we created some poetry, we engaged with sound, we saw some great video. There was lots of arts today. And one of the things I take away too was that idea about a health message for the arts, that sport has nailed that, and actually arts can do that too. But certainly what I will take away from today, most importantly, is I felt like Michael Jackson. So thank you, Maz McGann, because those kind of... They took me back to good old MJ. So thank you for that. Thanks to everyone. And just the last thought I had while you were speaking just before, Maz, is you were talking about the day when arts is just part of what we do to be healthy. And I was thinking, someone earlier mentioned about Medibank. Wouldn't it be great for those of us who fork out the money for health insurance, who can take it up for our dental, our physio, our massage, and our arts practice all on the same time? So who knows? Maybe that day's just around the corner. Thank you very much, everyone. Where are drinks? Oh, actually, I forgot to thank the most important person. Thank you. Thank you, hostess Tracy.
Oh, thank you. I've got one little thing I'm going to do to finish off.
You're going to
Thank you,
finish
Anthony.
off. Thank you.
Yeah, I've got one more
Thanks
little
very
thing.
much.
Thank you.